Important safety information for Endspring. What is Endspring? Endspring is a prescription medicine used to treat neuromyelitis optica spectrum disorder, NMOSD, in adults who are aquaporin 4, AQP4, antibody positive. It is not known if Endspring is safe and effective in children. Who should not receive Endspring? Do not take Endspring if you are allergic to Endspring or any of the ingredients in Endspring, have an active hepatitis B infection, have active or untreated inactive, latent tuberculosis. What is the most important information I should know about Endspring? Endspring may cause serious side effects including infections. Endspring can increase your risk of serious infections, some of which can be life-threatening. Talk to your healthcare provider if you are being treated for an infection, or call them right away if you think you have signs of an infection with or without a fever, such as chills, feeling tired, muscle aches, cough that will not go away or a sore throat, skin redness, swelling, tenderness, pain or sores on your body, diarrhea, belly pain or feeling sick, burning when you urinate or urinating more often than usual. Your healthcare provider will check if you have an infection and treat it if needed before you start or continue to take Endspring. Your healthcare provider should test you for hepatitis and tuberculosis, TB, before you start taking Endspring. All required vaccinations should be completed before starting Endspring. People using Endspring should not be given live or live attenuated vaccines. Live or live attenuated vaccines should be given at least 4 weeks before you start Endspring. Your healthcare provider may recommend that you get a non-live, inactivated vaccine, such as some of the seasonal flu vaccines. If you plan to get a non-live, inactivated vaccine, it should be given, whenever possible, at least 2 weeks before you start Endspring. Increased liver enzymes. Your healthcare provider should order blood tests to check your liver enzymes before and while you are taking Endspring. Your healthcare provider will tell you how often you will need to have these blood tests. Make sure you get all of your follow-up blood tests as ordered by your healthcare provider. Your healthcare provider will tell you if you need to wait to start Endspring if your liver enzymes are increased. Low neutrophil count. Endspring can cause a decrease in your neutrophil counts in your blood. Neutrophils are white blood cells that help the body fight off bacterial infections. Your healthcare provider should order blood tests to check your neutrophil count while you are taking Endspring. Serious allergic reactions. Serious allergic reactions that may be life-threatening have happened with other medicines like Endspring. Tell your healthcare provider before taking your next dose if you had hives, rash, or flushing after your injection. Seek medical attention right away if you have any symptoms of a serious allergic reaction, such as shortness of breath or trouble breathing, dizziness or feeling faint, swelling of your lips, face, or tongue, moderate or severe stomach, abdominal, pain or vomiting, chest pain. Before you take Endspring, tell your healthcare provider about all of your medical conditions, including if you have or think you have an infection. See, what is the most important information I should know about Endspring? Have liver problems? Have ever had hepatitis B or are a carrier of the hepatitis B virus? Have had or have been in contact with someone with tuberculosis? Have had a recent vaccination or are scheduled to receive any vaccination? Are pregnant, think that you might be pregnant, or plan to become pregnant? It is not known if Endspring will harm your unborn baby. Pregnancy registry. There is a registry for pregnant women who take Endspring. The purpose of this registry is to check the health of the pregnant mother and her baby. If you are pregnant or become pregnant while taking Endspring, talk to your healthcare provider about how you can join this pregnancy registry, or you may contact the registry at 1-833-277-9338 to enroll. Are breastfeeding or plan to breastfeed. It is not known if Endspring passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take Endspring. Tell your healthcare provider about all the medicines you are taking, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the most common side effects of Endspring? The most common side effects of Endspring include sore throat, runny nose, nasopharyngitis, rash, fatigue, extremity pain, headache, upper respiratory tract infection, nausea, inflammation of the stomach lining, gastritis, joint pain, arthralgia. These are not all the possible side effects of Endspring. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Genentech at 1-888-835-2555. For more information, go to www.enspring.com or call 1-844-NSPRYNG. For additional safety information, please see the full prescribing information and medication guide.